So I know I have a lot of friends who went to medical school. Okay, I was one of those people who was not sharp enough to go to medical school. Although I'm happy I didn't go to medical school. you
Honestly.
know, So see, we know that yes, we have very lot of sharp people, but but like I said, we are behind. It's not only the curriculum, but the infrastructure. That's a major issue. Now, knowing the challenges we have in our environment, then I think we need to adapt the kind of teaching or the processes we use in our practices so that we can get as much results for our patients within the challenges in our environment. And that means we need to change a little bit of the way we teach. It's not only the curriculum, but the processes, you know. So tell me, what do you think about innovation in education, in medical education?
What do I think of innovation
Yes,
in medical education?
yes.
Now, as I said initially, um, the curriculum in itself just trains you to be a good clinician.
Yeah.
But what we have issues now, I would say the paramount issue we have currently in healthcare in Nigeria and Africa. Okay, let me just give you a bit some numbers. So the WHO required um, doctor to patient ratio, which generally applies to all healthcare fields, is about 1 to 400, one medical professional to 400 patients. But in Nigeria now, it's between, now I'm talking about the general overview for all medical practices. It's between 1 to 6,000 or 1 to 8,000.
Wow.
So you can see the huge margin. So the issue we have now is availability of healthcare professionals.
Okay.
Inadequate supply, and then the population explosion that's currently happening in Africa.
Yeah.
So that's, and then we also have, let me give you another number. We have just about 6,000 specialists to handle almost 250 million people in Nigeria. So you can see the gap. The gap is enormous. So one of the issues now that we're dealing with, or we have to deal with in the next 10 years, if not, it becomes a total crisis, something that we can't control, is the availability of healthcare professionals. And one of the ways to do this is by providing, okay, now the questions you need to ask yourself. I did a survey recently on the reasons why medical professionals are leaving the country in their numbers. So we have thousands of medical professionals writing medical exams for international licensure, and we do not even have adequate number of staff for people in Nigeria. So why are people going? It's the normal thing, finance, people's finance are in the gutter. Doctors cannot afford nothing, nurses cannot afford nothing. I mean, even feeding has become a problem in the country, fueling cars, if they can even afford it. So it's a menace, to be honest, but we need to find the solution. The problem is stated there and it's getting worse, so we need to find the solution. So how does that come in with your question? Now, we need to help people see that as healthcare professionals, you do not have to fully depend on the government or your typical clinical job to just earn. You can use your knowledge and innovate to do some things that can help you. I wrote an article recently on some of the things that you can do as a healthcare professional in order to help you. And this is where it comes in this is how it comes into medical education. How can they restructure the medical education system to better help healthcare professionals to earn more?
Okay.
How can they even work remotely with their spare time to earn more? So you have things like medical writing. Medical writing is it's an ambiguous term. It involves a lot of things. You have the knowledge of drugs, you have the knowledge of practices, and then a lot of companies, big pharma companies, are making drugs every day. As a healthcare professional, you have the knowledge, you have the credibility to write on certain drugs, on certain healthcare practices for big organizations. You can earn from them. The typical amounts that you can earn is between $500 to about $1,000 at the beginner level. And then there are courses for these things. We also train too as well for these things. You have things like being a virtual healthcare assistant, meaning you can work with another healthcare professional in the United States or any other country that pays well or has a good conversion rate and earn well enough to satisfy yourself, even still being in the country. You can become a virtual research assistant with the knowledge you have had in medical school. You have research knowledge. On knowing how to apply your research knowledge, you can collaborate with other professors in other universities, become a representative for data collection and interpretation of data in healthcare in Nigeria, serving as a representative and earning towards like that. So there are so many things, but all these are out of the bracket of our curriculum. So if some of these things can be instituted, even if they are not taught by the lecturers or some of the people or the professors in the Nigerian medical schools, there are so many companies and institutions like Docxplorer that do some of these trainings and link people up with some of these companies, network with some of these companies in order to get them hired, and they can start earning like that. You can do so many other things. You can teach people how to do more public speaking so they can do health talks to earn more. You can teach people how to, some of the soft skills necessary to work with certain NGOs, because billions and billions of dollars are being spent in Africa for healthcare, but then the healthcare decisions are not even initiated by the healthcare professionals themselves. They are initiated by people that are in non-healthcare services. So
bureaucrats.
There's so so many things that you can actually do to earn, because we need to tackle the problem of this availability of healthcare professionals. People are dying in their numbers every day because of inadequate staffing. It's a big problem that people are not talking about. So I feel these are the necessary things that need to come into medical education. Yes.
Okay. See,